In today's video, we are talking about how a therapist or counselor might include parents into the therapy when your client is a teen. Hi, I'm Quenby Gallahan. I'm a licensed marriage and family therapist. I've been a therapist here in the state of California for over 15 years, and this channel, The Grateful Therapist, is all about counseling tips, personal growth, and mental health. So if you like learning about those things, please be sure to subscribe. So one of the questions I've received on this channel is, how do you include parents if you're working with a child or teen? In this video, I'm going to focus on teens, but no, this could apply to younger kids as well. And I always like to give the caveat, I am simply sharing some of the tools and techniques that I have developed over time. I'm not saying this is the only way to do it or the best way to do it. I'm just sharing my experience with you. A choice I have made as a psychotherapist is that if I am seeing a child or teen, the first session that I always do is with the parents. Not every therapist does this, but it's a choice that I've made in my private practice. Why? Because often a teenager is not able to give me the kind of information I need, the family history, the background. They have their own perspective of how they see things, how they see the family, how they see the main concern or problem. And the parents often have a very different experience of things or a perspective on things. So I always invite the parents or guardians in for the first session. I do that session without the child present so that the parents can download to me and give me all the information that I want. I call that session a parent interview, and when a parent calls me and says, I'm interested in you seeing my teen, I explain to them the first session I always do with when the client is a minor is with the parents or family members, whoever you think has important information for me. I ask a lot of questions, and then the parents have the opportunity to give me a lot of information. It is so valuable. I feel like I'm working in the dark when I don't have that parent session. I do one day a week at an elementary school, and those are kids that I see that do not have a family structure where the guardian or parent would be able to come into my office. They just cannot manage that. So I work with the school counselor and the principal and the child, but often I have very limited contact with the parents or guardians over there, and it is much more challenging. So this is a choice I've made. I made this document that really helps me with the parent session. All my therapy tools are available over on Etsy at The Grateful Therapist. There's a link in the description. They're all $5 or less, and they're just tools that I've created that may help you. This is a list of some of the questions. It's a very simple form. I use this during every single parent session just to, I have notes here on things that I want to be sure I ask, like, about the child's personality, family history of any mental health issues, histories of trauma or major life events. So I can just go down this thing like a checklist. I find it extremely helpful for me. And a lot of these things that I'm going to talk about today may be different for you depending on what your position is. I'm a licensed marriage and family therapist. I have certain guidelines, regulations, standard of care based on my profession. If you're watching this, you might be a school counselor or a mentor of some sort. Hopefully there's still valuable information in this video for you. Maybe you're a parent and you're thinking about getting your teen or child into therapy and you're wondering about this. I hope there's some useful information. So when I do a first session with a teen, I'm very open and honest and transparent with them and say, hey, your parents probably told you I had a session with them. They've given me everything from their perspective. In my experience, the teen perspective is often a little different than the parent perspective, so I'd like to hear everything from you. I think that establishes trust right away with your teen or child because I'm coming right out and saying, hey, I met with your parents. They told me about the trouble you've gotten in at school or the social issues you're having or this big event that happened or trauma in your life. I've heard it from them, but I want to hear it from you. And I do explain to the teen that, yes, therapy is private and confidential. However, you're a minor. you're living with your parents, they're maybe paying for therapy or bringing you to therapy, usually parents at some point want to have kind of a check-in with me, the therapist, or maybe me and the teenager. So we have to be able to give them some information about what we're doing in therapy. I want to give the teen a lot of sense of control and choice and options. Teens love that and need that. So if there was ever something that I thought we needed to communicate with the parents, I'm first going to talk to my teen and say, listen, as I prepared you for in our first session, there are times parents want to check in and know what we're working on or want some information. I let them know that ahead of time so they can expect it. And then I'll ask the teen, what do you feel comfortable at this stage in me communicating with your parents? You have a legal right to confidentiality. Do you want to talk? Can I talk to them about that we're working on some coping skills for anxiety, or that we are working on understanding your relationship with your sister that's really difficult? So I can often speak to parents in general terms like that. I don't have to give every item specific of what the teen said and what some teens want my help with that and need it, and that's fantastic. I let the parents and the teen know. I'm always trying to build relationships and bring the family together. So how can we do that? That's a very important question I often will pose to the teen. If they're telling me something challenging that I think, as a parent myself, the parents ought to know, I'm going to ask, how can we talk to your parents about that? What's a good way to start talking to your parents about that? Do you want me to talk to them? Do you want them to come into the session with us so I can help you talk about that? Every once in a while get a rare teen that says, absolutely not, we're not doing anything with my parents, they can't come in here, don't tell them anything. And I respect that unless it's one of the exceptions to confidentiality, right? I like to be, and I think of myself sort of as a bridge between the teen and the parent. Both need help communicating with each other often, and that's something valuable I can really offer. I'm a family therapist, so I have no problem bringing in members of the family with the teen. Maybe they say, well, don't bring my dad, but I need to talk to my mom about this, and you can help. Great, let's bring in. Or they want the whole family. If a teen, their parents want to come in and they say, absolutely not, I will respect that. I don't ever want to put a teen in a very difficult position. I like to give lots of options and choices of how we can include the parents in the session. Sometimes the parents really want to come in, and if that's appropriate and the teen's willing, 100% that's what I want to do. But I also respect them if they say, I cannot, I'm not ready, or I can't, okay? If a teen agrees, yeah, you're right, this is going to be awkward, but I really do need to talk to my mom, then I spend time with the teen preparing them for the teen session with the parent. I'm not just going to wing it and say, come on in, mom. That could be challenging, right? I want the teen to feel safe and confident and like I'm on their side, and that I'll kind of have their back to help them with whatever needs to be talked about with the parents. So I'll prepare them for that. Okay, and I'll take notes. What is it that you really want to communicate with your parents? Okay, I'm going to put that down. What are you afraid is going to happen? I'm afraid my mom's not even going to listen. She never listens. She's going to talk right over me. Okay, so I can help you with that, teen. I can make sure to pause, mom. And so that you really get heard, we'll make sure she really hears you. And we might role play. I'll role play with the teen. Oh, you're afraid this is going to happen if we bring your grandma in. Okay. What do you need my help with? What do you really want to communicate? If there's something in there, a fact, and they say, please don't tell them that I did this thing. As long as it's not dangerous, as long as it's not part of that limits of confidentiality, I will respect that. I might say, do you think we should talk to her about it? How do you think we could? And if they absolutely refuse, I'm going to respect that. But you, as any type of clinician, mentor, therapist, counselor, that's one of the ways we can really help families, is to help them come in together and really communicate and feel heard and seen. They may not agree about everything, but we can help with that minimum goal of making sure the other person feels really heard, seen, and understood. So let me give you an actual example from my private practice with a family. So I was working with a teen, and there were definitely some family dynamic issues that needed to be addressed. So I thought it was appropriate, and I assessed that it would be safe to bring the parents in. They really wanted to get into therapy, and the teen was sort of reluctant, like, oh, I don't know, this is my special time with you. I tell you everything, I don't want them using my time. Okay. She wasn't adamantly against it, though. There was a little room for opening. I'm like, well, we meet every week. How about if they come in, like every other week? No, every other week is way too much. Okay, what about once a month? Okay, I think I could do once a month, that the parents come in for part of the session once a month. And I'm like, great. So they had choices, options, and we can always renegotiate. We can see how it goes. But I find it extremely helpful to include the teen openly, honestly, and in part of that decision-making process. I also should probably address, it doesn't happen that often, but every once in a while I'll get parents that call me and they're like, hey, we're really concerned about this thing with our teenager. What do you think's going on? And they're sort of wanting to get some information. Of course, I'm always going to call that parent back and we're going to talk. I prefer to talk to the teen about it first, and I will definitely be open and transparent with both people and say, I will let your teen know that you called me and that we talked. I'll talk to my teen client about it and see what they feel comfortable sharing with you. So I get to kind of be that bridge. I have total respect for the parents wanting to know what is going on with their teen. They need information, they need reassurance, they have a right to know kind of what we're working on. So we're going to communicate with the parents in some way, but it's the level of what the teen feels comfortable sharing, when, how, and in what ways. And I need to have like an almost no secrets policy like I do with couples, where it's like, I'm going to let the teen know that we talked and that this is what I shared. And teens appreciate that. I think they need it. Teens are always working on this trust thing. You've probably, if you have a teenager, you know what I mean, or if you've worked with them, trust is a central issue kind of developmentally for them. So I need to build that trust with that teen and letting them know, hey, your mom called me, I'm going to call her back, or what do you feel comfortable from therapy sharing? And sometimes they're like, listen, they want me to talk to the parents sometimes. They say, listen, I don't want to talk to my mom. You need to let her know that I'm not happy about this, and she needs to talk to me about it. Okay, like I'm sort of a bridge in a way, but I think it's a great way to build trust with your client by including them in those decisions, options, choices about how to include the parents. And I'm always all for including family and parents as much as possible. Okay, so I hope anything in this video might have been helpful for you. Let me know what other comments and questions that you have around this issue. And again, this is just one way that I do it based on my license, my state, and some decisions I've made through trial and error working as a private practice family therapist. Thanks so much for being here. See you in the next video.